Assalamu alaikum rahmatullahi barakatuhu. As you all know, today we have the orientation and information lecture on infection control program today. Myself, Dr. Hajar, quality team. So the today's topic, I'll brief you about the introduction part of infection control program. Then we'll go through all these important topics of hand hygiene practices, PPE, personal protective equipment, then blood spill management, management of needle stick injury, waste management, and standard precautions. As much as concise information and practical application, whatever is possible, everything we'll discuss today, inshallah. So, as you all know, the importance of infection control practices nowadays, as we have gone through the experience of pandemic this year, and due to which we know how important the practices of infection control are to prevent most of the different types of routes of transmission of infections, like airborne or droplet or contact. So these practices of infection control are really, they are the important milestones in the protection of many maximum infections can be prevented. As it is well said, prevention is better than cure. So the main aspects of this infection control, we are going to discuss it today. So this is some statistics where it has been shown that estimated rates of healthcare associated infection worldwide at any time, over 1.4 million people worldwide are suffering from the infections which have been acquired through the hospitals. Okay, see, these are the statistics which shows how is the impact, not because of the infection which has been acquired outside from the community, but the infections which have been acquired through the hospital, that is from the healthcare workers or exposure to the hospital premises. So it shows how impactful is the infection to the population. So in the modern hospitals in the developed world, 5 to 10% of the patients at least acquire one or the other infections. And in the developing countries, it is still more higher. That is 20 times, 2 to 20 times higher compared to developed countries. And it exceeds at least 25% the exposure of hospital associated infection. So, and see the pictures, how broadly it is affecting the people, 5 to 10% to 25%. And finally, in the ICUs, the hospital associated infections can affect 30%, and the mortality can reach up to 44%. So this is where infection control practice comes to the role to play to reduce the transmission of hospital acquired infections. These hospital acquired infections can cause serious illness. It can prolong the stay of the patients in the hospital and affect the availability of the beds. It can cause long-term disability. It increases the mortality, excess deaths, high personal cost on the patients and their families, as well as it can give a remark on the reputation of the hospital. So the clean care is safer care. Transmission of healthcare associated germs with a particular focus on hand transmission. Maximum focus is on hand transmission from healthcare worker contact to the patient, or either way. This main way of transmission of infection can be controlled and prevented by applying control measures. So the best method of protecting the both the community as well as the healthcare workers is by practicing the good strategy, that is hand hygiene. So The purpose of hand hygiene is to improve the practices. Why we are applying the hand hygiene practices? Because and also we are applying the standards, policies at the level of PHCs, at the level of hospitals. That's because to reduce the transmission of the pathogenic microorganisms to the patients and healthcare workers. And also, today we'll discuss what are the indications and the techniques for proper hand hygiene. As you can see here, the patient is there on the bed of ICU, and you can see the environment here, the patient's surroundings, the environment, the bed, the clothes, the hands. These are the indications of where the patient is having the organisms like germs of Staph aureus and Pseudomonas mirabilis, Klebsiella. These are the very resistant organisms and it can result in massive pathogenesis in the patients. So, like bed linen, furniture, objects. So, all these are contaminated, patient's immediate surroundings. So, this is the step one of hand transmission. Step two, you can see here from the healthcare workers' hands. The nurses usually could contaminate their hands up to 100 to 1000 CFU of Klebsiella during clean activities like lifting the patients or checking pulse or BP or temperature. So, staph aureus or other organisms can be transmitted on either way. And step three here, you can see the germ survival on the hands. Following the contact with the patients, the germs can survive at least 2 to 60 minutes. This is enough time for any organisms to enter the human being and cause multiple symptoms and problems. So, if there is absence of hand hygiene, the longer the duration, the higher is the degree of hand contamination. And step four is because of defective hand cleansing results. So if the product which has been used for the hand cleansing is inappropriate or insufficient, or the duration which you are doing the hand hygiene process is not sufficient, if you do it very fast, early, and in an improper way, what happens? The transient microorganisms will still be there on the hands, and even though the hand washing with the soap and water or hand, but they have proved that hand rubbing with alcohol-based solution is more effective. Step 5 is contaminated hands by cross transmit germs. So the patient A, healthcare worker is examining without this is uh, he is not following the hand hygiene practice and going to the next patient, patient B, and checking with the same hands which are contaminated from the patient A, and this can result in transmission of the infection and results in healthcare associated infections. So hand hygiene, by this evidence, you could have understood how important it is to prevent the healthcare associated infections. So in hand hygiene, we have different types of procedures, that is hand wash. Hand wash, we can do it with the help of a plain soap and the water at least for 40 to 60 seconds. Just remember it, at least minimum of 1 minute the hand wash has to be done. And antiseptic hand wash, that has to be that is the washing the hands with antimicrobial soap, or yeah, that is washing the hands and the water with antimicrobial soap and other detergents containing the antiseptic agent, that is antiseptic hand wash. Antiseptic hand rub is the application of antiseptic hand rub to inhibit the growth of microorganisms without the need for an exogenous source of water, and there is no need of rinsing or drying with the towels or other device. So this is hand rub without the use of water or any types of drying with the towels. Whereas surgical hand scrubbing, in this we wash the hands by using the antimicrobial soap that is pre-operative before doing any procedure, surgeries. They scrub their hands, they wash the hands from the uh, tip of the fingers up to their elbows, and they do it in a specific procedure. That procedure before any surgery or any before any procedure, that is called as a surgical hand scrub. Alcohol based hand rub, in this procedure, alcohol containing liquid or gel or foam that is used for the application of the hands to inactivate the microorganisms and to temporarily suppress their growth. And this is at least has to be practiced for 20 to 40 seconds. Okay. So please remember the hand wash for at least 1 minute, and the alcohol based hand rub at least for 20 to 40 seconds. This is the procedure of hand wash, which has been recommended by the WHO. So to effectively reduce the growth of germ on the hands, the hand washing must last at least to 40 to 60 seconds by performing all the steps which has been indicated here. You can see first the water is switched on, the hands have been made wet, followed by apply the soap, then rub it on the palm, then on the dorsum, in the in between the spaces of the fingers, and the vice versa, and palm to palm, then the back of the fingers, okay, this part here in this direction, and finally like this, rolling over the thumb area totally like this, so that rotational rubbing of the left and the right thumb, and finally in the central part of your palm, rotational rubbing backwards and forwards. Okay. So in the right and left palm, finally rinsing the hands with the water and dry it with the tissue, and with the same tissue which you dried, use that tissue to switch off the tap, and then your hands are safe. So this is the method of hand wash recommended by WHO. And the hand rub, the duration here 20 to 30 seconds. As you can see, you have take the hand rub into the palm, into the cupped hands, so that it covers all the surfaces. Palm full, good amount you have to take and rub it in between and into between the fingers and in this direction, and the thumb area and the center part of the palm, and finally the once the gel has been dry, then your hands are safe. The hand hygiene with the soap and water is indicated only when the hands are soiled with the blood or the body fluids. And if the hands are not visibly soiled, then only a waterless alcohol based antiseptic is acceptable for 20 to 40 seconds. Okay, so the hand hygiene, that is hand wash, has to be done only when the hands are visibly soiled with these blood or body fluids, whereas the when it is not soiled and it is appears to be clean, alcohol based antiseptic is acceptable for 20 to 40 seconds. So most of you are aware about this, that is all the healthcare workers in the WHO should be followed this WHO 5 hand hygiene indications, which are called as 5 moments. So what are these 5 moments? That is when we have to do hand hygiene at this moment, which is 2 before and 3 after. 2 before touching the patient, before performing any clean or aseptic procedure, and after exposure to the body fluid, after touching the patient, and also after touching patient surrounding. This part is most of the times ignored. They think we have not touched the fluid or touched the patient, but Even if you had a exposure to the patient surrounding, it is very important to do the hand hygiene after that. So here you can see the 5 steps. Now, before touching, then before doing any procedure, after touching, so touching the surroundings. So this is all followed by, or before and after, hand hygiene has to be done. Before, before, before touching patient, before aseptic task, after any exposure to the body fluid, like after changing the catheters, or after putting IV cannula, and also coming into contact with the patient surrounding. See, if you follow these in your daily routine activities, you have to keep decontaminating your hands. That is, as soon as you start the duty, before direct contact with the patients, before donning the sterile gloves, before inserting even a catheter or peripheral vascular catheters or any invasive device, even though it doesn't require surgical procedure, after contact with the patient's intact skin, like touching the patient for taking pulse or blood pressure, or when also helping the patient to lift, and after the contact with the body fluids or excretions, or even the mucous membrane, or doing any oral examination, or the gynecologist performing any type of PV examination, any type of exposure to the body fluids and wound dressings, you have to practice hand hygiene. Also, after contact with inanimate objects, like even the medical equipment you have touched, which has been used for the testing of the patient, always, even though if it is in the immediate vicinity of the patient, the hand hygiene practice has to be followed. After removing the gloves, and even when you are leaving the work area. So from the start of the duty until you leave the duty, you have to keep doing the procedure of hand hygiene. Some people think that hand hygiene is not needed when they use gloves. Actually, the gloves plus hand hygiene makes clean hands. Without hand hygiene, the gloves doesn't make any sense. It doesn't have the significance that it can protect the healthcare worker or the patient from the cross infection. So the gloves without no hand hygiene, it results in germ transmission. So always keep in mind, the use of gloves does not replace the need of cleaning your hands. You should always wear gloves only when indicated, and before wearing gloves, always have to use the practice of hand hygiene. And even after removing the gloves, it has to be followed by hand hygiene practice. But we should not forget the moments when hand hygiene is indicated and falls under hygienic or social practice, that is also even after using any daily needs toilet, after before preparing the food, eating, coughing, after coughing. These practices of our daily routine also have to be always followed by hand hygiene before and after. Most of the common problems healthcare workers complain is because of use of continuous practice of hand hygiene. They have dryness of the skin care. So the solution is, you people, healthcare practitioners can use hand lotions or moisturizers to prevent or minimize the irritant contact dermatitis, which is associated with antiseptics or hand wash regularly. Moisturizers can be used, and nowadays all the most of the antiseptics are always containing the skin moisturizers, and also contains vitamin E, so that it reduces to the most extent of contact dermatitis and the dryness of the skin. What are the other aspects of hand hygiene? It is very, very important not to wear artificial fingernails or extenders. And the natural nails, the tips of the fingers nail should not be, that is, it should be less than quarter inch. And do not add soap to a partially empty soap dispenser. That's what the people do when already the soap dispenser contains some amount of soap. That so again adding on new soap, topping off dispenser can again result in bacterial contamination. So that practice should not be followed. So keep your nails short, not to wear the nail varnish or the polish, the false nails. Don't wear rings. That's okay. In our application of practices of Sibahi and procedures, and also according to WHO, the hand hygiene educational and motivational programs have been monitored related to the practice of the healthcare workers, and the compliance has been monitored and evaluated and projected in the form of percentages. So to assess overall program to improve the hand hygiene practice of healthcare workers, first they will educate every personnel has to get training in all types of patient care activities to practice hand hygiene, where the hand contamination practices can occur, and the advantages and disadvantages of the various methods have been explained to clean their hands, and to see how much the healthcare workers are adhered to their practice. We have to monitor and recommend hand hygiene practices and provide the personnel with the information regarding their performance. And always keep encouraging the patients and the families to remind the healthcare workers to decontaminate their hands. So it should be a continuous process and a cycle where continuous motivational programs have to keep occurring at all the levels of primary healthcare and the hospitals, so that the healthcare workers as well as the patients keep motivated to practice hand hygiene. This is the WHO format which we are using to monitor the hand hygiene practice. This is how it looks like. You can see here, this is observation form with the headings of faculty, that is like Ministry of Health Service, PHC, primary health center, or the hospital, the ward, the name of the primary health center, the department of the primary health center, like department can be a clinic or immunization clinic or dental or laboratory, emergency service, like this. The period number has to be given, and the date and the start time and the duration. According to the recommendation, they tell that it should not exceed more than 20 minutes and it should not be less than 10 minutes. And total duration will be written here, and session number. What is the number of session? As many sessions can be done according to the facility, it can be done per day, or more than twice or thrice in a day, or once in a day at least, for continuous month, and it can be recorded. Then the observer, whoever is the infection control practitioner, their signatures, initials, and the page number. And here you can see the category, professional category, if they have any coding. And here you can have individuals, professional category, who was it, doctor, nurse, or technician, or dentist, or whoever it is. And according to the healthcare worker, and we have these boxes here. You can see these boxes are 5 moments of hand hygiene: before patient, before any aseptic procedure, after the exposure to body fluids, after touching patient, after touching the patient's surroundings. This is the opportunities. These are the 5 moments. If the person does any of this opportunity, as indicated according to the procedure, whether hand hygiene action was done or not, either it was hand rub or hand wash, or Is it mist or gloves was used? So there are options here you can tick. So indications, these are the reasons for the hand hygiene, and the indications are not exclusive and may be single or multiple at times. Sometimes you can tick more than one or two if there are more indications. At least one indication defines the opportunity. Multiple indications define one opportunity. This things whenever now this is a theoretical information, and once we are visiting the centers, definitely we are going to explain them in detail about how to do it practically. And most of the PHCs have already been trained related to this hand hygiene file, how it has to be done, evaluation and the calculation. And as I have already told you, these are the different parts of the observation form. So as you see here, there are 4 rows, and each row of the column corresponds to the opportunity. Okay, the 5 moments here, they are there for different professional category. So if you take example, nursing staff cleaning hand before touching the patient. Okay, then you see before touching patient, nurse professional category, there is hand rub. So it is considered as one opportunity and one action. If example, the doctor did not clean the hands before touching a patient, missed. Okay. Finally, what will be done is the complaints will be calculated. It is the total in the sheet, how many actions were done totally and how many opportunities were there. Numerator will be the actions and denominator will be the opportunity. And it will be multiplied with the 100 and we'll get the percentage. So the performed hand hygiene actions total, what are the actions? Hand rub how many, hand wash how many. So total actions will be totaled up, divided by what were the total opportunities. That will be multiplied with the 100 and we get the percentage. So here, this is the basic compliance calculation. Here the opportunity and whether hand wash was done, hand rub was done, or if it is yes, 1 or 2 or 3 or 4, how many opportunities according to how many hand wash or hand rub. And finally, the total opportunities, total hand wash, total hand rub. This is for session 1. Consecutively for all the sessions, at least in this one sheet, there are 20 sessions at least. And how many total opportunities, hand wash, hand rub, activities, actions will be counted up, opportunities will be totaled up. That will be calculated, actions divided by opportunities into 100. So who will be the responsible person for the hand hygiene practice to be implemented at the PHC level, center level? To monitor this, the infection control team, the practitioner will monitor and supervise the compliance to the policy in the center to give the required feedback through infection control committee. And they will provide regular and targeted education and training to the healthcare workers. And it is the duty of the infection control practitioner to improve the awareness and change the attitudes and work practices among the institution or the center. And to have in place everywhere, wherever there is hand wash facility, hand rub facility, to keep the specific protocols and the guidelines on with the updated SIBAHI and MHED standards, and to monitor what is the availability of hand wash agents are available or not available, get the stock and related supplies like hand rub, then tissues, whatever is required for the practical application of the hand hygiene practice. Okay, so now we have completed hand hygiene practice. So what are the key points which you have to remember is hand hygiene is the basic infection control practice which has to be done from the start of your day up to the end of your day. Either you are on the duty or half duty, always please keep practicing hand hygiene. Hand wash for at least 1 minute, hand rub for at least 40 seconds, and the method keep practicing, so that unconsciously you have to keep practicing before the patient, before touching patient, before any procedure, after touching patient, after any procedure, after touching the body fluids and surroundings also. And monitoring charts and the files and regular lectures and the placements of the stock and the hand hygiene agents. So that should become a routine of your daily activity. Then only the hand hygiene practice can affect to a great extent to prevent the healthcare associated infection and the cross infection between the healthcare worker or the practitioner to the patient, and from the patient to the healthcare worker. Okay. So the next point what we'll go about is the very important another part of infection control program is PPE. PPE is personal protective equipment. What is this? This is a personal protective equipment, means we are wearing some equipment to protect the individual healthcare worker. So our main aim is to improve this usage of this PPE and to protect both the healthcare workers as well as the patients from exposure to infectious agent, and to reduce the opportunities for the transmission of microorganisms in healthcare settings. And we have to find out what are the indications and what is the technique to use proper PPE. What is PPE? PPE, that is a specialized clothing or the equipment which is worn by an employee to protect against infectious material, and it includes gloves, gown, aprons, facial protection, and mask. Okay, all this. Whereas barrier precaution is also another term for PPE. It means a variety of barriers and respirators which are used alone or in combination to protect the mucous membrane, airway, skin, and clothing from contact with infectious agents. Okay. In all the centers, PPE should be always available in all the departments. Okay, wherever the healthcare personnel is getting exposed to infectious agent during the healthcare activity, and healthcare worker shall decide which PPE has to be used appropriate for that type of situation or task, depending on what the health worker might be exposed. Like according to the activity which has to be done by the healthcare worker to the patient, according to that task, they have to choose the PPE, suitable PPE. PPE, like you can see, respirators and masks are there, different types of masks are there, surgical mask, N95 mask, medical gowns, aprons, caps, shoes, glasses, goggles, face shields, medical gloves. So different types of respirators, masks are there. This is all PPE, gowns, surgical gowns, non-surgical gowns, aprons, head caps, shoes.
Lost the sound. الصوت مش واضح. ما في صوت، ما في صوت لو سمحت، ما في صوت. ما في صوت.
Some.
هاجر المايك مقفول يا دكتور هاجر.
Yeah. Can you hear me now?
Yes, yes.
Okay, thank
Yes,
you.
yes.
Sorry, there was a technical problem suddenly. Okay. Use the examination gloves. As I have told you, these are the indications of IV insertion or removal, drawing blood, pelvic vaginal examination. Also during handling and cleaning the instrument, handling the waste, and the cleaning the blood spill. During all these procedures, the gloves have to be used. And rubber heavy duty gloves. It will be worn by non-medical personnel or by the housekeeping or the laundry or by the maintenance personnel. And do not wear the same pair of gloves for the care of more than one patient. Okay. When wearing gloves, change or remove the gloves during the patient care when moving from a contaminated body site to a clean body site within the same patient. So these are the very important points. You have to keep it in mind. And change or remove the gloves after touching any contaminated site and before touching the clean site or any environment. Change gloves as soon as they are torn or punctured. Now coming to the parts of gowns. The gowns are always in the PPE kit. The gowns are readily available in all the working areas of the departments of the center or the hospital. And a gown should not be used routinely. I have seen many doctors always, or healthcare workers, always wearing the gown, especially in these COVID-19 days. But this is not recommended routinely. Wear only once and then discard at the appropriate place, like yellow bin. But wherever it is indicated, the gown has to be used, where you can expect splashes from the patient, or you are doing any procedure like dental procedure, where you can expect the splashes or contamination of your clothes. So there are indications for every PPE, and the gown should be large enough to cover all the protected areas of the exposed skin, to protect all the exposed areas. And wear the gown very properly, so that there are given the ties have to be accurately adjusted and tied up, not like loosely just wearing the apron. And as soon as you have used the gown, you have to, if it is soiled with any infectious fluid, it has to be removed. before leaving the room, and immediate work area when contaminated with the blood or body fluid. And wear a gown or a plastic apron to protect the skin and clothing during the procedures, as I told you, which can cause splashes or aerolization of the body substance or can cause soiling of the cloths. Sterile gowns are also available, but only for the procedures which are invasive aseptic procedures like central line, changing the dressings, extensive burns case, or sterile technique. Fluid resistant gowns can be worn where there is likelihood of splashes or contamination of the blood. Reusable items and non-disposable aprons should have clearly documented cleaning schedule. If there is some gowns which has to be reused, actually it's not in practice. If such gowns are being used because of non-availability or anything, if they are non-disposable and they are washable, then always the laundering has to be checked before it is donned. The next aspect of PPE is face mask. Face mask will protect any this face mask surgical particulate respirators they are okay. Then these masks will protect when there is any body fluid secretion and splashing procedure is there, and droplet precautions. Okay. Then mask should be fully cover the nose and the mouth and prevent fluid penetration, and should be fit over the nose and mouth. Okay. Then the mask always, as we have heard, N95 mask, there is a fit test for N95 mask for different types of people. There is a types of mask, small, regular, large. Okay. So always have to be followed by use of fit test, and the mask should be worn properly. And once the mask has been used, it has been worn, discard and do not hang it on the neck or keep it in the pocket. Okay, these are the small things which has to be practiced to avoid the cross contaminations. Eyewear, the protective eyewear, either in the form of goggles, will be used to prevent the splashing of the blood or any infectious fluids into the eyes. And the goggles also have to be fit particularly from the corners of the eye across the brow, enough to protect the eyes. Okay, so this is the procedure to perfectly fit the type of goggle onto the corners of the eyes across the brow so that your eyes are protected. And the face shields are used to protect again the face from the splashes and the sprays, and wear face shield as alternative to goggles, so to provide protection to other facial area also. Other part of PPE used is caps and the footwear. So caps are large enough so that it covers all the hair, and closed-toed shoes will be used to avoid the contamination of the infectious fluids or protecting the foot from the injury. And practice extreme care when you are removing and donning, okay, during the delivery to avoid hand contamination. So the PPE can protect from most of the types of infections which can cause by contact from droplet or airborne. As you know, the contact, when we are in contact with the other infectious person, by wearing gloves, gowns, we are protected from, and the patient is also protected from our types of infection or from the environment. And droplet infections by using surgical mask within 3 feet away from the patient, the droplet infections can be um, uh, prevented to the great extent by using this surgical mask. And airborne infections can be prevented by using a particulate respirator like N95 mask. Compliance is very important with the PPE, and that is how frequently PPE has been used, and appropriate use of PPE, doffing, donning, accurate use. and its availability stock. All this compliance of PPE will increase with regular employee education, and employees must be trained to know at least the following. That is, every employee should know when and what type of PPE has to be used when it is necessary, how to use, how to remove, how to adjust, how to wear PPE, what are the limitations of PPE, how to take care of PPE, maintain and dispose the PPE. And the supervisors like infection control practitioners, these people have to ensure that each employee will receive and understand the training with the written certification and the date of training, and always a certificate should be there with the employee file. And incident report, as you know, there is incident report for any adverse reaction like allergies and sensitivities for different types of occurrence. So even if there is any problem related with the PP, that has to be reported in incident report to the immediate supervisors, which will be further be reported to employee health clinic. And the manager of the institution will make sure the adequate resources will be there for availability of PP has to be available in appropriate place in enough stock. That is adequacy, proper fit protection, and everybody has to undergo fit test for the mask. Every employee knows how to use his or
اوكي.
okay. Yeah, infection control staff will be responsible to provide the education for the staff and management on this policy of application of PPE, and they will act as a resource for the guidance and support whenever there is a need of PPEs or advice is needed, and a proper advice on individual risk assessments for PPE decisions. All staff that must follow PPE policy and procedure and advise the patient or the clients or visitors of any infection control requirements with regards to the proper use of PPE. Okay. So you can see this is the procedure of wearing the PPE. First, use hand hygiene either in the form of first hand wash or hand rub, and use avoid using resident sink. Okay. Then put on the gown with the sleeves. Select the proper usually the standard size will be available. Secure the neck and the waist. Next, put on the mask, either a surgical mask or if it is needed N95 respirator mask. So first is hand hygiene, then the gown, then the mask, then also the goggles. Put on the eye protection in the form of goggles or face shield, and finally the gloves. Okay, and the gloves has to be extended over the cuffs of isolation gown. It should be extended over the gowns to secure any spill or any contamination of the inner side of the gown. So keep the gloved hands away from face. Avoid touching or adjusting PPE while wearing. Replace the gloves if they become torn. Limit the surfaces and items touched. Okay, so this is the precaution you have to follow when you are using the PPE. And once the procedure is done of recommendation or the task, next is remove the PPE. That is, first is you have to remove the gloves. That is the first part of the PPE which will be removed. That because these are the PPE which have been got more contaminated. After removing the gloves, next is remove the gown slowly by untying the neck and the waist, and slowly roll it, turn around from this is the inner side, this is the outer side. Slowly roll over and put it into the yellow bin, into the garbage, and followed by hand hygiene procedure. Finally remove the goggles and the face shield, and The last part which has to be removed is the mask. Okay, the first is gloves, then the gown, hand hygiene, then eye protection or the face shield, and the mask, and also next again hand hygiene. Okay, so the PPE must be removed very carefully to avoid self-contamination, and take off PPE at the doorway before leaving the room. Okay, but take off an N95 respirator not inside the room. It should be outside the room of the patient or the where the procedure was done after the door has been closed. So the yellow bin always has to be kept one outside the room. For example, if it's a room of isolation room where the infectious patient like H1N1 or MERS or COVID-19 positive patient or suspected is there, wear the mask inside. Come out of the room and then remove the mask. So I would like to show you the video demo.
Personal protective equipment should be selected based upon proximity to the patient and the likelihood of contact with any blood or body fluids during procedures in the patient care area. This video will demonstrate the proper sequence for donning personal protective equipment based on guidelines from the Centers for Disease Control. The first step in personal protective equipment is good hand hygiene. The second step of the procedure is donning the gown. The gown should be fastened at the back of the neck and the waist by tying a bow. The third step is the selection of respiratory protection. One option might be a procedure masks are used for droplet precautions. Droplet precautions are used in the care of patients with influenza. To apply this mask, gently crease the metal insert to create an indentation for your nose. Then cuff your hands around your ears and spread the mask to cover your face from the bridge of your nose to below the chin. Finally, ensure the mask is snug and comfortable on your face. Procedure masks also come with attached eye protection. This mask is applied in a similar fashion. Respirators act as a filter to prevent small particles from entering the airway of the person wearing them. A respirator should be fit tested annually in order to ensure a good seal. The properly sized respirator should always be used. Place the respirator on your face and position the straps at the back of the head and at the base of the neck. The elastic strap should be in contact with the skin on your neck, so remove any hair that is in the way. Press the mask along the edges to seal it to your skin. Finally, breathe deeply in and out, feeling for any areas where air may be escaping along the... Respirators can be shaped to fit the face or be folded. Folded respirators are applied in fashion, ensuring that the respirator is fully unfolded and has a tight seal with the skin. Breathe deeply in and out, feeling for any areas where air may be escaping along the edges. Facial hair will prevent the respirator from making a tight seal with the skin. Even a small amount of stubble will compromise the seal and reduce the protection provided by a respirator. If the respiratory protection you selected does not have attached, eyewear should be selected next. Protective eyewear might be safety glasses or goggles. Many shapes and styles are available. The final step in the procedure is the application of gloves. Ensure that the cuff of each glove covers the wrist of the isolation gown. A secure fit will prevent gapping while Before entering the room, ensure all personal protective equipment is in place and comfortable. This will prevent you from adjusting your personal protective equipment while in the patient care area and potentially contaminating unprotected areas of your body. You are now ready to provide care to your patient.
Okay. This was donning of PPE. Now we'll see about doffing.
Personal protective equipment should be selected based upon proximity to the patient and the likelihood of contact with any blood or body fluids during procedures in the patient care area. This video will demonstrate the proper sequence for doffing personal protective equipment based on guidelines from the Centers for Disease Control. The first step in the procedure to remove personal protective equipment is doffing the gloves. Gloves are removed first because they are likely the dirtiest item and are contaminated on the external surfaces. Grasp the first glove on the external surface at the cuff and gently peel off. Hold the removed glove in the gloved hand, then slide a finger of the ungloved hand under the remaining glove, touching its clean side up, and gently peel the second glove off over the first glove. Discard the gloves in the trash. All movements in doffing should be slow and intentional to prevent the aerosolizing of any contaminant on the used equipment. The second step in this procedure is to remove your eye protection. The glasses or goggles are contaminated on the outside, so touch only the earpieces or elastic bands while removing them. Eye protection should be placed in the trash or be placed in a designated area for reprocessing. The third item to be removed is the gown. The most contaminated areas of the gown are the front and sleeves. Unfasten the ties at the neck and waist, then remove the gown by slowly pulling it down and rolling it away from the body with the clean side out to form a bundle. Use the foot pedal to lift the lid on the linen hamper. Then place the entire gown inside the bag. Disposable gowns may be discarded in the trash. Be sure that the entire gown is inside the trash can. Gowns left hanging are a risk for contamination. The fourth step is the removal of respiratory protection. It is removed last to prevent any transmission of contaminated particles to your respiratory tract while removing the other. Touching the front of the mask or respirator should be minimized during removal. When a mask or respirator has two elastic bands, remove the bottom one first. Discard the mask in the trash. Finally, perform good hand hygiene immediately after removing all of your personal protective equipment.
Yeah, by this we understood the importance of PPE. What is PPE? What are the components of the PPE? From the head to toe, it is a protective wear for protecting the healthcare worker as well as the patient from the health care associated infections. It includes the cap, then the goggles, and the mask, different types of mask, the gowns, and the gloves, and the boots. So all this constitute the PPE. And how to don and how to doff the PPE, it is always associated with the uh, before PPE hand hygiene, after PPE hand hygiene, and not to use all the PPE for all the types of procedures. Specific PPE for specific type of procedure and the task, and the doffing and donning has to be done appropriately and accurately to prevent the self-contamination and the environmental contamination. So the PPE kits have to be always available in all the departments wherever the infectious procedures related to the patients will be performed. And the PPE kits stocks have to be made sure available with the help of the manager and infection control practitioner. Regular trainings and the evaluation of the compliance of PPE has to be tested. Okay, thank you. So I have finished hand hygiene PPE. Next, go to the next topic of another important part of infection control is blood spill. What is blood spill? See, why we are worried about blood spill? Blood spill or any infectious body fluid spill, the spill of any uncontained biological material or human or blood or body fluid secretion or excretion on the surface in the premises, that will lead to unsafe exposure conditions. Okay, so to prevent this infectious conditions which will be arise because of exposure to the infectious fluid spillage within the center, we have to have specific procedure which is blood spill management procedure, and that will be done with the help of a spill, which is nothing but it's a container or a box or a package which will contain necessary tools so that whatever the spills will be uh, occurrence in the center or in the hospital that will occur will be taken care of. So always the standard precautions has to be applied. PPE has to be used before doing blood spill management, and the blood spill should be cleared up before the area is a spill should be first cleared. Next, the area has to be cleaned with the help of cleaning liquids, because to avoid the increase of spill, okay, the spill area should not be increased by using cleaning liquids in addition to that. And also the generation of aerosols infections into the atmosphere has to be avoided by early management of the spill. The disinfectant of choice which we use in the spill kit is chlorine generating disinfectants like Clorox. So most of you, for a brief introduction, I will tell there is a blood spill kit. What it is, it is containing disinfectant, like it may contain Clorox tablets, it will contain some powder which will absorb the spill, and it contains with same like PPE, the kit, and it will contain the brush or the broom where the infectious material will be collected into the pouch and then finally disposed as a hazard into the yellow dustbin. So this spill kit is containing all the necessary equipment which is used to clean the spill of infectious fluid. And the spill kit should be the responsibility of the infection control team to supervise regularly whether all the contents are there. If it is used again, to replace the kit back into that appropriate place. And all the staff in that area, whoever is concerned with the exposure, like housekeeping facility, housekeeping people, staff, as well as the healthcare workers, has to be trained and oriented how to use and manage the spill kit. So the nursing or the medical staff will deal with the spill immediately, and they after that they will alert the housekeeping before it dries up, so that the procedure will be followed up. What is there are if the spill, there are two concepts here. If the spill is less than or up to 10 centimeter, then it is considered as spot or small spill. In that case, just put on the disposable gloves and if needed other PPE, and wipe the area immediately of that less than 10 centimeter area with the help of paper towels, and followed by clean it with the water and the detergent or with the available disinfectant, like 70% alcohol or chlorhexidine spray, and rinse and dry the area and discard the gloves in the yellow plastic bag, and followed by wash and dry your hands, same like hand hygiene policy. If the spills are large, more than 10 centimeters, then only this procedure will be followed. Okay, and less than 10 centimeters, that is, close off the spill area to traffic. Use a wet floor or a biohazard sign. So if it's an area in the center or in the hospital where the spill has occurred in the form of infectious fluid, blood or vomit or of the infectious patient, keep a wet floor or a biohazard sign so that the patients or the other healthcare workers doesn't come into the contaminated area, and evacuate the area when the spills are there, when the patient is suspected of hemorrhagic fever or SARS or swine flu. Locate the spill kit, put on the disposable gloves as well as other PP which is applicable. If there is any accidentally if it is the infectious fluid or the blood which was caused in a container of broken glasses are there or tops are there, with the help of a forceps, take it and keep it in a sharp container and contain the spill. The spill should not spread more, so that surrounding the spill, keep the paper towel so that it absorbs the spill spreading up, and use a span or a scraper to pick up the material. Then flood the spill. After you use the pan or scraper to pick up the material, then flood the spill with the, after that you have to use 1:10 solution of chlorine bleach, that is 1 part of Clorox and 9 parts of water, and at least for a contact period of 10 minutes. So if there is a spill of more than 10 centimeter, first is you will keep a biohazard symbol, and followed by which you will keep you will alert the people to be away, and you locate the spill kit, take the spill kit and contain the spill kit with the help of tissues, and remove the sharps if they are there with the help of forceps. Then with the, you can use the powder if it is, I will show you the demo later, powder to absorb the liquid spill and take away that scrap away that spill material into the pouch. After that, clean that contaminated area with the help of Clorox solution. Sometimes in the kit, most of the times it is provided with the chlorine tablets. You can use that, or you can make your own dilution of 1 part of Clorox and 9 part of water. A small jug with the measurements also will be provided, or in a bucket 1 cup of Clorox and 9 cups of water can be used to to clean up the area of contamination, and it has to be in contact for at least 10 minutes. Okay, next use the paper or cloth towels to soak up and remove all the spill bed and chlorine. Push the towels from the edge of the spill into the center. Discard the bleach soaked towels into the yellow plastic bag. All the infectious material, PP or the towels which has been used, all has to go into yellow plastic bag. Then the person who will be responsible for this is infection control team. They will make sure that the spill kit is prepared and all the contents are available in the spill in each unit. They'll monitor and supervise the implementation of this policy in the center, and also to make sure the relevant staff are familiar with the correct procedure for dealing the spillage of the blood or the body fluids that may occur anytime throughout the center. And the nurses and the technician should deal the spill immediately, and followed by which they have to alert the housekeeping to do the decontamination procedure to replace the single-use items in the spill kit. After each use, the nurse has to take responsibility and implement the policy. The housekeeping personnel will clean up the spill according to the procedure which is mentioned in the policy also. So I'll show you a demo about the spill.
OSHA requires that equipment and surfaces be cleaned and disinfected after contact with blood or other potentially infectious materials. This should be done according to the employer's exposure control plan. Locate and open a bloodborne pathogen spill cleanup kit. Put on appropriate protective clothing, including disposable aprons, caps, and eye protection. Requires that equipment and surfaces be cleaned and disinfected after contact with blood or other potentially infectious materials. This should be done according to the employer's exposure control plan. Locate and open a bloodborne pathogen spill cleanup kit. Put on appropriate protective clothing, including disposable aprons, caps, and eye protection. Wear double gloves. OSHA requires that equipment and surfaces be cleaned and disinfected after contact with OSHA requires that equipment and surfaces be cleaned and disinfected after contact with blood or other potentially infectious materials. Pour the absorbent material done according to the employer's exposure control plan. Locate and open a bloodborne pathogen spill cleanup kit. Put on appropriate protective clothing, including disposable aprons, caps, and eye protection. Use a scoop to pick up the material. Wear double gloves. Place all cleanup supplies, including protective body clothing, into a red bag for proper disposal. Absorbent material over the spill. Apply a disinfectant to the area immediately or as soon as feasible. Thoroughly wash your hands. To decontaminate the area, apply an appropriate disinfectant, such as a fresh solution of diluted household bleach. Use a scoop to pick up the material. Dilute 1/4 cup of household bleach into 1 gallon of cool water. Contact time for bleach is generally considered to be the time it takes the product to air dry. Place all cleanup supplies, including protective body clothing, into a red bag for proper disposal. Apply a disinfectant to the area immediately or as soon as feasible. Thoroughly wash your hands. To decontaminate the area, apply an appropriate disinfectant, such as a fresh solution of diluted household bleach. Dilute 1/4 cup of household bleach into 1 gallon of cool water. contact time for bleach is generally considered to be the time it takes the product to air dry.
Yeah, so we have covered up hand hygiene. Then next with the PPE and blood spill. Blood spill key points are: if it is less than 10 centimeter, no need to follow this procedure. If it is more than 10 centimeter only, you have to use the spill kit. And the spill kit should be available in most of the in the recommended departments wherever according to the policies and procedures of the infection control team will be keeping the blood spill kit and checking for the stock, and the concerned department nurse will recheck if there is any single item is missing in the kit and replace it. And the housekeeping training staff as well as other healthcare workers in the center and the hospital has to be properly trained and informed about the availability of the spill kit and the usage. Okay, and followed by blood spill, always it has to be reported in the incident form and informed to the infection control practitioner and the head nurse. Okay, so the next topic what we will go to speak is about the management of the needle stick injury. The needle stick will be in any, always the healthcare worker is exposed to the procedures, invasive procedure or any type of oral examination like in dental department or any type of immunization or in emergency services. So the healthcare workers will be exposed to the needle stick usage for the purpose of examination or giving treatment. So in that case, if there is any accidental prick to the employee or to the housekeeping staff, also if there is any exposure to the blood and the body fluid exposure in the healthcare workers, it has to be informed with the help of incident reporting and to the infection control practitioner, and the proper precautions has to be, first aid measures has to be followed, which will be described now. So these are any potential infectious materials like human body fluids, which contain the infectious material, or percutaneous injury with the needle prick or cut with a sharp object. It has to be managed accordingly. Why we are worried is because if we don't take standard precautions, these bloodborne pathogens, which is the mode of transmission with the help of prick injury or with the cut or with the exposure of the body fluid, these important infectious diseases can happen like HIV, hepatitis B virus and hepatitis C, which are more pathogenic and can cause more complications to the healthcare worker as well as the patients. So always the percutaneous injuries or any exposures has to be reported to the staff healthcare clinic, and should initiate hepatitis B vaccine if the incident has within 24 hours, and has to be given a vaccination card. But if the hepatitis B vaccine has been taken already and the titers are adequate according to the standards, then the protocol will not be like to follow the hepatitis B vaccine. So that has been described in GCC guidelines and will be updated to the employee health physicians to how to deal with the hepatitis B vaccine protocol when there is any percutaneous or sharp needle injury, and give the vaccination card followed by vaccination, and complete all the 3 doses of vaccination, and employee will be given a copy of completed card. And if there is any exposure happening, what they will do, whenever there is a needle prick, don't squeeze, bleed this slide, let the bleeding side bleed gently by its own flow, and go to the wash basin, wash it with the soap and the water, let the blood flow gently, and once it stops and it is cleaned with the soap and the water, cover it with the help of a dressing, and um, uh, also have to apply isopropyl 70% alcohol, and check the patient status with whose needle it was got pricked. So if it's positive hepatitis B or no, according to that it will be dealt accordingly with the help of employee health physician, and report the incident to the immediate superior infection control practitioner or the head nurse, and fill up the OVR sheet, and have to be signed by the immediate superior, and go to the employee health clinic with the OVR form, and finally the employee health physician will evaluate the employee. These are the basic steps which an employee or the housekeeping staff or anybody who is exposed to the needle stick or any accidental prick, like a housekeeping staff and transferring the waste, or if the sharps have not kept properly in the by any accident, or while doing any procedure on the patient. If this happens, these are the steps which you have to follow. Okay, so bleed the slide gently, let it bleed, and then wash it with the soap and water, apply the alcohol, and put up the dressing, and start the procedure of information with the help of incident report, OVR, and finally employee health physician will evaluate the patient status of any infections, and accordingly will immunize the employee and the patient if it is necessary. So bleed it, wash it, cover it, report it. This is the management of needle stick injury. If there is any exposure with the body fluid or to the mucocutaneous or the open part of the healthcare worker or the patient, flush it first with the copious amount of the water, wash it, and then follow the same procedure as in the needle prick. And if it's a human bite, follow the same needle prick injury procedures. If the source of the patient is found to be known hepatitis C positive or HIV or hepatitis, then the protocol will be followed by the staff health clinic. Employees who are exposed to viral hepatitis and HIV will be counseled for the duration of the follow-up. They'll be not allowed to give any or donate blood or plasma or any tissue, and advise the pregnant or lactating mother not to breastfeed for HIV positive, and sexual act protection safe for both the partner advice has to be given if it's the exposure to these type of infections. An employee health physician, we would have trained him and helped him with the GCC guidelines. According to that, the employee health physician will take the history of the exposed employee and document in employee health file, and do the management according to the guidelines. And the nurse, which is responsible for the employee health physician, will draw the samples from the employee and the patient for testing hepatitis B antigen and antibodies and anti-HCV and HIV screening. Okay, so this is another important infection control procedure, that is any needle stick injury or exposure of the mucocutaneous areas to the infectious fluids. Next, coming to the standard precautions. See, the procedures whichever I have spoken to you in the form of hand hygiene, blood spill management, and management of the needle stick, and using of PPE, all these procedures totally, they are nothing but universal or standard precautions. So these standard precautions are very important. The center should have a defined system to apply these standard precautions, so that to prevent the transmission of communicable disease between the staff and the patients and the visitors. So what are standard precautions? The standard precautions are a group of infection control. It's not single. They are the group of infection prevention practices which are applied to the care of all patients in healthcare settings, regardless of the suspect or confirmed presence of an infectious agent. For example, in an emergency or in a reception or in the triage or in the dental, wherever when the patient is coming, we don't know their serological status of whether they are positive with the HIV or hepatitis or any other infectious disease or any respiratory borne infection. So we always have to use standard precautions so that the contamination or prevent the transmission of communicable disease between the patient and the healthcare worker. So the primary strategy is the prevention of healthcare associated transmission by using standard precaution. This is to wash hands, hand hygiene, wear PPE and protective clothing, use gloves whenever applicable, mask wherever applicable, and goggles when it is needed, and face shield. So according to the task and the procedure, using appropriate infection control strategy to protect and to reduce the transmission of contamination from the patient or from the healthcare worker are nothing but standard precautions. So all the of their infectious status, without knowing their infectious status, standard precautions has to be applied always. And also we have to apply the standard precautions for the body fluid secretions, any types of infectious fluids, and all the healthcare workers should always use and appropriate must hand hygiene procedures at appropriate times. So, and PPE whenever it is necessary. So all this constitutes standard precautions. And even the respiratory hygiene, the cough etiquette, okay, that is using the proper procedure to avoid the respiratory mode of transmission, and to encourage each other to follow the cough etiquette by keeping the hand or using the tissue to cover up their face and the mouth when they are coughing. That is called cough etiquette. So even in the labs and the bedside, everybody has to follow the procedures. And lab specimen, when there is during the part of time of collection, transport, and at the time of testing, the standard precautions have to be applied. And even in the laundries, when they are transferring the infectious cloths and the laundries, that time also the standard precaution by the housekeeping staff in the hospital and the center have to apply standard precaution, and it has to be well trained, and regularly lectures and training and complaints has to be tested by the infection control team. And also, even if there is any needle stick, scalpel injury, reporting spillage of blood, any and how to keep a non-hygienic or incontinent patient separation, then to ensure the reusable equipment is sterilization procedure, disposal procedure, injection practices, medication practices, hand hygiene, PP, then cough etiquette, all everywhere we have to apply standard precautions. So these are standard precautions: hand hygiene, PPE, respiratory hygiene, as well as the any devices, resuscitation devices used like mouthpieces, bags, and ventilation devices also have to be sterilized and used and disposed according to this protocol. And when handling, disposing the contaminated items, patient care equipment, instruments, device, needle, sharp, care of the environment, textile, laundry, even the medical waste which is generated in the healthcare center or the hospital have to be followed with the, during all these procedures, standard precautions have to be followed. During the patient placement, if the infectious patient is there who is suspected with COVID-19 or H1N1 or any respiratory type of infection or any other type, how to isolate them, where to keep them, what is the pathway, all this information and standard precautions have to be applied. And in the place where injections or emergency immunization centers or the place, also the standard precautions have to be used appropriately. Who will be responsible to apply, to monitor, to supervise? The infection control team will be the responsible, and also to create awareness and to change the practice and attitudes among the institution healthcare workers. Healthcare infection control practitioner will be responsible as a team to continuously monitor the standard precautions application. Okay, so this is also one of the important aspect of infection control. Next, we'll go into the brief discussion of waste management. As you know, the waste is the infectious waste or non-infectious waste is generated in every type of institution, but in healthcare waste management we are more concerned because of its contamination and transmission to the patients and visitors and the healthcare worker. So we have to know the very specific good and application and the knowledge about the safe and effective management of the waste to deal and how to handle, how to train, how to transport and dispose the hazardous. And there are different types of waste. As you know, hazardous waste, that is infectious in the form of chemical or radioactive source which has been generated in the healthcare institutions. Infectious waste in the form of any type of waste which will have a chance of transmitting bacteria, viruses, parasites or fungi. Chemical waste in the form of solid, liquid or gaseous chemicals which will be generated during the procedures of laboratory or diagnostic or in the cleaning or disinfecting or sterilization procedures or radiological procedures or sharps, any sharps after immunization or vaccination, vials or needles or these type of waste. So different types of waste, how to deal with them. And as you know, we have a company, Sharika Sepco, which will be having a contract with most of the primary health centers, which will come to every center and wash the transport bins and the storage bins, yellow bins, where the yellow bags have been kept, and they will collect and they'll give the documentation in the form of date, and they'll visit regularly to all the primary health centers and take the waste. And this is how the policy will be applied for handling, transporting and disposing the hazardous waste specifically. And this will reduce the infectious chances and provide good safety for the healthcare workers, and has a proper guidelines. And as you see in PHC level, we have one bin for general waste like paper, tissue, and which is not infectious. Infectious waste, most of it is yellow. It is indicated by yellow, and whatever is infectious in the form of any secretion or any type of fluid, which is generated from the patient or during the procedure, has to go into the yellow bin, and it should not be mixed up with the non-infectious and infectious. And sometimes by mistake the gloves after examination will be found in the other bin which is not infectious. So this mixing up should be avoided. And there is another sharp puncture proof container specific for sharps. And as you know, the policy for sharps is after immunization or after giving injections, never recap the needle. Always just remove the cover after it's used with the needle and the syringe totally. You have to put it into the sharp container, and once the sharp container is more than 3/4 fill, then only you have to remove. Or if it is contaminated or it is having any liquid contamination or with the due to the problems, sometimes then it can be disposed. Or else if it is 3/4 it is full, and when it is then it has to be put with a sticker with the date and the name and of the name of the department or the clinic, and the concerned person signature, and it will be taken and kept it in the waste room, and the company will come and take it away from the waste room. So even the spills and the chemical waste which will be generated from the labs and radiology will be closed, and after it is filled, taken up and kept it in the room, and will be disposed and transported and disposed by the company. Okay. So the main concepts of waste management will be should be aware where to put what type of material, where to put infectious, where to put non-infectious, yellow, how to, the housekeeping staff who is responsible for collecting the waste from all the clinics should know how to transport in a yellow trolley, collect the waste from each clinic in one way and come out and in one pathway without spillage, with proper usage of PPE, and reporting any sharp injury to the infection control team, and transport and storage in the yellow bin in the waste room. And a waste room has its own policies. The waste room should be having the proper standard according to the policies recommended by Sivahi, and the waste room should have bins, yellow bins with the hand hygiene facility, the PPE, and with the ventilation procedure and temperature recording, and regular cleanliness protocol guidelines, and with the drain and with the flush facilities. Okay, so with the proper PPE recommendations to the housekeeping staff, and the awareness and education. So these are the aspects of waste management. As you see, this is the biohazard symbol which will be mentioned on the yellow waste, which means that it is infectious. It is not appropriate to touch or deal with it without using proper PPE.
تقول معنا عنه امس شوف اليوم
So the collection and transport at the primary health center level, it will be first applied and policies and standards will be prepared by the infection control facility, healthcare, and some procedures do not overfill the waste, and the container should not be mixed. Okay. And even transporting waste include expired hazard drugs or any kinds of waste must be trained. Spill management has to be trained before collection and transport of bags. They should be fully sealed and locked. Okay, so, and data stickers has to be there on the content of, and always the labeling should include the biohazard logo. And the transport hazardous medical waste with the healthcare facility should be there in a designated yellow trolleys, okay, that will guarantee efficiency for loading, unloading, and it should be leak proof and easily cleansed and disinfected. Such type of trolleys have to be used. And all the PHC should have trolleys for transport separate and for storage separate. So always use appropriate PPE. And always the medical and the healthcare waste has to be dealt with the PP, and washing hands and hand hygiene practices has to be applied at every level. And records have to be used. Signatures from the generating facility is required on tracking record at the time of pickup. And the environmental services is responsible for maintaining documents for tracking records or shipping documents and certificate on medical waste which is removed from the facility. So always to minimize the workers from exposure, it is recommended to use heavy duty gloves and protection, eye protection, cover and seal the container before removal from the point of generation. Remove the collection frequently so that to prevent overfilling, and integrity of the waste handlers during handling and segregation to prevent spillage and protection of contents. And if there is any damage, leaking container should not be shall not be overpacked, and place it with the second container. Never open or transfer waste bags between the containers because of risk of exposure. So training is very important for at the level of generation handling. Train all the people about the information of hazard, safety procedure, action, notification should be done to the supervisor, and if there is an accident. So proper segregation, containment, handling, transporting at all types of levels of waste management, proper methodology and guidelines have to be followed. And Department of Infection Prevention Control will be, including the environment health, occupational safety person will be implementing and monitoring the policy. And the housekeeping will be responsible to deal with the waste disposal and supervise the compliance always to the provision of this guideline. Okay. Thank you. So today's aspects of infection control program were very, very important. The most of the important program headings I had chosen and I had explained and demonstrated in the form of videos also. So the main key points take home today are hand hygiene, hand wash, what is the duration, and keep practicing compliance, and before 5 moments, and what are the hazards, and what are the availabilities, who will be responsible, how to monitor compliance. Then PPE, what are the components, how to do and don't, and availability and training of the staff, and compliance is very, very important to test and keep on reinforcing the training, and to make the center with the maximum application of infection control measures in the form of hand hygiene, PPE, management of the spill, availability of the spill kit, and reporting incident form, OER form, and also about waste management, standard precautions overall at all the levels. And so as you have seen, the impact of infection control measures can, how much extent it can prevent the healthcare associated infections among the healthcare workers and the patients and the visitors. So please keep on practicing and apply it. And thank you for your cooperation and presence. If any doubts, please, you can ask me if you have any doubts or concerns. Okay. Any doubts? Okay. Thank you all for your participation, and please try to practice and apply these infection control measures in every level of your daily practice. Thank you. Assalamu alaikum.